Hi, my name is LOpdahl. Today is March 21st, 2022. This class is Teaching Strategies in Nursing Education. This is Module 5, Assignment 5, Activity-Based Teaching and Simulations. We'll be reviewing 5 different areas of different scenarios. The first area we will review is discuss the use of mental imaging and mental practice process with teaching motor skills. Mental practice, which involves imaging or visualization, a skill without body movement prior to performing the skill, can enhance motor skill acquisition. While using mental practice, it is important for the nurse to use intrinsic and augmented feedback. When teaching a motor skill, it is important that if a mistake is made by either the teacher or learner, it is acknowledged immediately. We all make errors, we must remember that, but it is a recognition of them that is key to proper learning. The next area is develop an interprofessional case scenario that would be appropriate for undergraduate nursing students. And we are going to use an example and strategies found in Bradshaw, figure 16.1. My case scenario is related to patient safety for discharge disposition. Mrs. Rose is a 52-year-old woman who lives with her husband and adult daughter in a 4-bedroom, 3-bath home. Mrs. Rose has been healthy her entire life with no health history. Recently, Mrs. Rose has been experiencing paranoid thoughts of her husband cheating on her when there has been no suspicion to be needed. 3 months prior to Mrs. Rose being admitted to the hospital, Mrs. Rose was diagnosed with paranoid schizophrenia at age 52. Mrs. Rose was always a devoted wife and mother, never did drugs. One day, Mrs. Rose was having a schizophrenic episode where she said her brain told her to pour gasoline on her head and light herself on fire. Mrs. Rose was lucky because she only sustained burns to her right side of her face, bilateral ears, and right upper torso with no inhalation involvement. Now that Mrs. Rose is healed from her burns and Mrs. Rose is ready to be discharged from the hospital, it is a question of safety for Mrs. Rose and her family. Where should Mrs. Rose go? Back home with her family or an inpatient psychiatric unit? When discharging a patient that can be a threat to self and others, it can weigh very largely on the family unit. Mrs. Rose will never be the same, and living with her family may not be safe for any of them considering her diagnosis. What are your thoughts on Mrs. Rose's discharge plan? The next scenario, describe a clinical situation that could reasonably be translated into a simulation. Which type of simulation would be most appropriate? What psychomotor and cognitive skills would you hope there would achieve? How would you envision your role as an educator? What would you include in the debriefing? I remember a couple years ago, we had a patient that was on a soft diet. All of a sudden, a family member runs out and says he's choking. A perfect simulation for this situation would be to ask the family member, did he just eat anything? As we were asking the family member, we were assessing the patient and laying him down. We notice the patient is breathing and not choking, but has a lot of secretions. Upon suctioning the mouth, we get a lot of brown clots. Like chunks. It ended up that the family member gave the patient a chocolate candy bar while the patient was on a soft diet. The perfect simulation for this situation would be the ABC, airway, breathing, circulation. During the simulation, the teacher and the learner have to be able to assess and determine what the best course of action is. Knowing the patient has secretions shows that there may be something in the oral or throat cavity that is creating a possible blockage. As we debrief on the situation, I would include the importance of asking questions and understanding your patient, since not one patient is the same. Knowing that the patient is on a soft diet and the family member gave them a candy bar, the critical situation for choking due to the incorrect food intake. Now we're going to construct a statement or scenario that could be used on the basis for a debate in an undergraduate nursing ethics course. A debate that is very common, but should be brought to ethics. Many times we see very ill patients that we know are being kept alive due to internal feeding and intubation. How do we as providers determine if the patient should rest peacefully or be kept alive by outside interventions when no family is there to make the decision? Especially when we know that the quality of life will never be the same. A scenario is working in the burn ICU. We get patients that are severely burned. Some do not make it due to the burns, and some that are severely burned do survive. But survival means that many more surgeries, possible amputations, vision loss, contractures, constant pain, and many medical expenses. How do we as providers make those decisions for one that has no family member while knowing the future life outcome? And lastly, create a game to help learners review the instructional methods discussed in this module. Some suggestions might be formats related to Jeopardy, Trivial Pursuit, a word search, or cross puzzle. I've decided that the perfect game would be a game of cards. One card has questions and the other card has the answers. In order to win the game, the one that answers the most correctly wins the game. Each player would start with 5 cards of answers, then 5 cards of questions we face up in the middle, while taking turns on being able to answer the most correctly. Whoever gets to 20 wins the game. Thank you very much and have a fantastic day.